Access to healthcare. Indeed, access to quality healthcare is always critical to everybody, and especially when you visit medical facilities and you expect the best of services. Of course, you always expect that the services will be optimum. But if you're a patient, for example, as those who visited the Korle BU Teaching Hospital yesterday were not expecting that the services rendered were below par, because there were charges that they were asked to pay because these were increased fees for the services rendered by the facility. Some as much as twice the previous charge. The cost of a new folder for a child and consultation, for instance, is now being pegged at 42% up from, or 42 cedis up from 21 cedis. And the hospital is already maintaining the new charges will ensure enhanced service delivery. But is that a case? And Hannah Odame has been interacting with patients, and some have said they were surprised at all these increments, but some just well, did nothing about it, just had to go with the flow and pay for those services. So we'll watch how Hannah Odame put together that very story and interacted with some of the patients and officials of the Korle BU Teaching Hospital. Then we'll come here and speak to the chairman of the Ghana Coalition of NGOs in Health. They have a lot more to say on this very subject. Do stay on. We're having the chairman in the studio. Gabriel Banaku is here. And so just watch the story. We'll come and do the interactions later.
The new rates form part of a comprehensive review of fees charged by government agencies all over the country and were approved by Parliament in March this year under the Fees and Charges Amendment Instrument of 2014. The agencies where the new fees came into effect on March 12, 2014 include the Driver Vehicle and Licensing Authority, Criminal Investigations Department of the Ghana Police Service, the Ghana Broadcasting Corporation, and Rent Control Department. It has been argued the revision will help them generate more revenue so they could be more efficient. At the Korle BU Teaching Hospital, the fees are not uniform and are structured depending on whether you are an infant or an adult. There are also special fees for foreigners. These patients and clients who came to the Korle BU Polyclinic and Hospital were amongst the many who were not prepared for the additional charge.
It is quite a disturbance, because I was with a guy over here, and because of the increment, he was not able to pay it, so he has to go back and go for local pharmacies so that we can give him something to, reduce the pains in him.
What about you yourself?
Oh, for me myself, it has worried me a little, because the money I brought here was not enough. So because of the increment of some things, it is really a disturbance.
After you were told you have to pay 42 today, what did you do?
I don't have anything to say. The only thing I have to do to pay. If you don't pay, you go back.
Is it causing any inconvenience in your pocket?
Yeah, it's causing, because these days it's hard to get some money into your pocket. So when you get the money and you think, oh, today I think it will help for me to go to the hospital, and you go and the difference is too big and you can't pay. If the sickness is high, definitely you know what will happen.
When I came here, I was told I have to pay 42 cedis, and I think it's just too much. Because at first I used to pay only 12 cedis. I cannot pay, so I'm just going back home. There were also patients, however, who had figured out a way around the problem.
This morning I was coming for an eye test, and when I came I was asked to go for my temperature before coming to stamp. But when I got to the place, I was told that no, they've changed, so we should read whatever. When I said reading, then they said no, they've changed everything. So actually first we were paying 12 something, then today we have
12 cedis for the folder.
For the folder, and today we are asked to pay 42. And I asked the lady, is it 42 or 4 cedis, 20 pesos? It says 42, and I said, wow. Then I said, only folder, and is so I told her, then I don't think I can go through my normal payment as usual, so I prefer using my nationwide card.
So initially you would have paid the
I would have paid
12
without
cedis.
using, because when you are going to stamp, the procedure whereby you go through before the stamping will take place, go here, come here, so I prefer paying straight at hand. So I've not been using the nationwide card at all, but today for the 42 I have to use the nationwide.
Is this inconveniencing you in any way?
To me, I don't have any problem with it, whether to pay cash or to, but at least let's put ourselves in the shoes of others. How are they going to cope with it? Yes.
I'm grateful. Thank you. Your
You're
name?
welcome. Rita.
Rita.
Ajeapo.
Thank you. All the best.
Thank you.
So these clients and patients that we have spoken to here at the Korle BU Teaching Hospital tell us that they have been taken by surprise at the new fees that are being charged, of course, with approval from Parliament. The hospital, meanwhile, tells us that they need these monies for improved infrastructure as well as efficient delivery of services to you and I. Here is the hospital's PRO, Mustafa Salifu.
Yeah, the hospital procures its inputs and resources from the market, and largely these are items that are imported, and because of the CD dollar volatilities, we have not been able to. We need to mobilize a lot more resources to import these things. So we realize that if we don't ask for this and then do it now, then the hospital will run into difficulties in the next couple of months.
So how many categories of revisions do you have?
There are more than, when I took count of it, there are more than 600 different categories.
Okay, so is this for NHI card holders or for those who don't have insurance, or everybody?
It's for everybody.
What went into these increments? Because a lot of people are saying that it's so huge. Imagine you are paying 12 cedis and it's now 42 cedis. Is it also huge?
It's huge.
The difference.
But so many things are taken into consideration in providing that kind of service. You know, you imagine the number of people who sit on you as a patient, and compared to what is even happening outside.
Did you inform your patients, your clients, ahead of this increment?
Yes, we inform them. You know, usually any time we revise our fees, you usually have such incidents occurring. You can get a global coverage in terms of the pre-implementation efforts. So people will come and they are taken by surprise. Want to apologize to such people for not getting the information.
So tell us exactly the changes, the positive or the enhancements we will see at Korle BU as a result of these increments.
The hospital will now be in a position to procure the consumables without much difficulty. As for the improvement in the service, is something we do daily, because this is about human life. You don't wait only for an increment to be able to do some of the things that you need to do, like handling a patient very well. These are things that we do already, but this increment will help us to meet our obligations towards our suppliers and contractors. It's something that lately we've had to do with a lot of difficulties, but to help us to do that, and then we'll be able to provide other services besides the consumables to our patients who come to the hospital. Yeah, we'll be in the position to provide new facilities and enhance even the working conditions for the staff and patients.
For now, it appears such patients who do not have the options available to Rita may either return with whatever medical situation they have or call for a bailout. Hannah Odame, Joy News, Korle BU.
And Hannah Odame has been tasked again to go back to Korle BU and see how Patients are really adjusting to the current increment following what she witnessed yesterday, that's Monday, at the premises of the Korle BU Teaching Hospital. We have the chairman for the Ghana Coalition of NGOs in Health, and Gabriel Benaku is my guest in the studio, and we're likely to make a lot more public commentary on the subject. And how many teaching hospitals do we have in Ghana?
I think we have 5.
We have 5.
Yeah.
Okay, one in America, I believe, the University of Ghana one.
Yeah.
Okay, so did you know about this coming, that they were increased?
No.
Because I know last year,
Yes.
the Parliament of our Republic really passed these new tariffs, or new fees, so to speak. Of course, it generated some brouhaha in the media and across the public space, but at least patients should have seen this coming.
Okay, first of all, we, the Coalition of NGOs in Health, represented in 201 districts.
You are?
Yes, 201 and 417 NGOs coming together. We are not against the increment, especially when we are pushing government to adhere to the universal access to health coverage. This is a universal convention that all countries are subscribed to. And also we are encouraging government to expand services as well as quality of service delivery. And so we are not against the increment as is done by Korle BU. But the approach is very wrong. And I want to put it to them that yes, as much as they want to meet the cost of running the facility, they also have to be mindful that we are being guided by regulations in the country. One, I know the Korle BU, they are also paid by the National Health Insurance. And one of the things we want to see is whether these increments are within the National Health Insurance capacity. That is very critical, because if National Health Insurance is paying for the services that they are rendering, we want to see that. Secondly, we want to see that whether they are aware of the policy on maternal and child health. And of
course, yeah, you don't expect that the teaching hospital like that won't be very much abreast of
yes, but this is contravention with what they are doing, and we think that, I mean,
with what the new policy on child health is.
Yes, it's supposed to be free. Children, for example, if you taking consultation from 24 to 54, this is over 150%. And having recognized that we have this policy guideline, I mean, it's totally not something that we should encourage. And 3, Korle BU receive other support. So we expect that somehow their running cost is still supported. So why are they rushing to put this on the ordinary people in the country? So we think that it's not just timely.
But let me ask you this. A child, because it's a child, but has been sent to the hospital or the facility by the guardian or the parent, shouldn't be paying for a folder? At least a folder is not something that you pay often. It's supposed to be, well, something that you keep your records in, and by which also gives the hospital some category of inventory that you really are a patient or a client of the hospital.
That's what we are against. A child is a child, no matter what situation is. So you
well, a child is also a patient.
Yes, but the child is, by our regulations, children up to 17 have been given certain privileges.
So who takes care of the
the state?
The state takes care of the
It is the state responsibility.
You know they're stationary.
Yes, but it is the state responsibility. Korle BU receive grants from government and other.
Well, they don't. I don't think they receive grants to be paying for stationery, to be putting together.
They do for running cost. They do for. So these are some of the things, and they always have a way of managing in such a way that people who really need healthcare do not suffer. And these are children, women and children. So we think that is very untimely. I mean, it's a wrong approach, no matter how they want to justify. So one thing they could have done is to publicize this, to sensitize the public. I heard the officer talking, which I think that is below the belt. He knew the processes, especially when increments are going to be done. the process has not been followed. This is a surprise kind of thing. This, we should not encourage it. And we are also encouraging the other teaching hospital not to repeat that, because it's very wrong for the people who most need their services. We are trying to drive them away, and that is not timely. It's actually not something that we should encourage.
For a number of fees or categories of fees that were increased by Parliament last year, for which, of course, we had public debates, the public should have been aware that when you go to Korle BU, at least there will be a time when some of these fees will be increased.
It is the responsibility of Korle BU to let public know when they are going to effect the changes.
They had notices.
They didn't show any notices. We are not aware. Yesterday, when I had the information, I sent a team to move around in Korle BU. We didn't have. Well, in
the story we showed, there are sections where there were notices that were noticed. Whether they were put there early enough, it's something that
it's not only just writing a letter and paste. That is not a good channel to communicate to your clients. Your clients, most of them are people who cannot read and write. So it is the responsibility of Korle BU to know that this is the mass of clients that we are dealing with. This is the way we ought to use. We have to use multifaceted approaches in communicating to your clients. And one of the best ways they could have done is to ensure that the radio stations, the TV station like yours, should be given, because you also have corporate social responsibility. I don't think if they come to you to ask you to make a 1-minute announcement about the increment, and in order to prepare clients when they are going to the hospital to be well prepared, you will charge. Even if you are charging, it's just going to be very, very minimal. So I think the approach is very untimely, and we will not allow this. We will not accept this. We are calling on them to use the right channels to ensure that
as a coalition of NGOs on health, what are you going to do about it?
We will look at it. We will look at it. There are a lot of procedures. There are internal mechanism and also in conformity with the national regulation. We will look at it, and if there's a need for us to do something, we will actually do it. We are a very informed organization, so we will be able to do something about it. But for now, we think that it's very untimely. The approach they have used is very wrong, and they should not do that, because their aim is not to make too much profit, unquote, too much profit. This is a public organization. This is a teaching hospital. This is a center for research and referral. So they should not create this kind of problem to deter people from accessing services there, because this is a national center where government put in a lot of money and a lot of personnel to be able to provide the needed services.
But you do agree that Korle BU is not Father Christmas?
That's what I'm saying. We are not against the increment.
Indeed. But it ought to as a leading teaching hospital in Ghana, they are inundated with thousands of cases annually.
Yes, but they are a public organization. They are a national organization. They should understand that. Their interest is not to make profit too much.
Okay.
Their interest is to break through, but provide quality and effective health services as a national leader in terms of health services.
Mr. Benaku, in that very context, what was your response to a directive by the health ministry that they wanted to wind off some of these public sector organizations of at least substantially of government subvention? And I know last year this very announcement was made. Efforts have been made indeed by organizations like Korle BU, the Confirmatory Teaching Hospital, etc., to make them partially self-sustaining, so to speak. How do they raise funding to undertake administrative and other management costs?
We are not against the public-private partnership arrangement or allowing this government institution to be semi-independent, autonomous. But we think that it is not just increasing fees at the facility that makes you independent. There are a whole lot of things that, if you go to private hospital, they charge almost the same fee as Korle BU do previously. But they are able to break through. What is it? Time. They are very timely. They are able to communicate very well to their clients, so people appreciate their services, so they go back. And so whatever fee that you want to give there, they will pay. They are able to receive the service within a limited time. But Korle BU, sometimes you can be there for 3 weeks and you are not.
So you're saying there's effective delivery of service?
Yes. So if they want to increase,
and the
they must show effectiveness.
of the highest quality.
Exactly. They must show effectiveness. They must show great leadership. That's what we want to see. Otherwise, why are you charging? You are charging and we say have to follow queue. We cannot meet the specialists and we are paying. We continue to pay. No. So we are in support of the move by government that these organizations should have some independence to be able to run the facility effectively. But they themselves must come out with a plan that we should appreciate, not what we see now.
Listed below are some of the reviewed laboratory, for example, laboratory charges. Now, lipid profile has been increased from 24 Ghana cedis to now 54 Ghana cedis. Full blood count, now 15 to 35. We have liver function tests to 55 from 25. 28 to 63 is a new rate, the rate of increment for prostate-specific antigen. Blood urea electrolyte has now been moved from 15 to about 35 Ghana cedis, and well, laboratory activities in hormonal lutein, I hope I pronounced it adequately, has been moved from 25 to about 63 Ghana cedis. Now, do you think we're getting these reactions because the clients who go there, as far as their categorization, is a mixed bag of those who have and those have not? Or it doesn't matter the categories of clients?
It matters, but we are much concerned about the issue of women and children, because most of these issues are directly affecting women and children. Women and children, when they go through almost all these processes. So which means that some
of the women are working. Some of them have got spouses. Some of them have got guardians.
How many women are working?
So you can't categorize them.
How many women are working? We still don't have the larger population of women who are gainfully employed. Most women in Ghana are still unemployed. They are insufficient to be able to manage this. That's why the government came out with the policy on maternal health. So what we are driving at is creating opportunity to leave the people we said we will ensure that by end of 2015 we are able to meet maternal and child health. We are already creating more problems. So we will not meet the 2015 target. And even the post-2015 that we are now organizing, just 2 days to come, we are meeting to look at the universal access to health and health financing. And the issue of maternal and child health is critical. Recently we had the health summit. It was the topic of the day. And I believe you were even there to capture it. And you saw how a lot of Ghanaians mounted placards intrude into the health summit at Gimpa to show to government and the minister that we are not doing well in maternal and child health. And now, just after 2 weeks, Korle BU is creating this another tension to deter a lot of women and children from accessing their facility. That's why we are not happy.
Well, somebody would say it's well and good that you're raising these concerns, but where were you when these increments were passed by Parliament, giving the leverage for Korle BU to give this up this quantum of their charges that they gave?
I was quite informed during this proposal. One of the conditions is that they must show that they are capable of providing quality service. We haven't seen that in Korle BU.
So it should be commensurate to
exactly.
the provision of quality
haven't still seen that. It's not about just painting the facility. No, we need to see the human resource capacity. We need to see proactiveness or the service delivery. We need to eliminate these frustrations that people go through at Korle BU. And we need to see technology being displayed in Korle BU so that it makes things much more easier for people to access services. So I want to state that we are not against increment, but it must be procedural, it must be informed, and they must use the right channel to be able to communicate so that people are well informed and prepared.
Okay, so now what are you going to do?
Like I said, We will look at their internal mechanism and see whether they are even in conformity with the national guidelines. And then we will look at what was given to them by, approved by Parliament. And then based on that, we will know what to do. We represent the masses in which they claim to provide the services to for their existence. So we will look at it.
Now, we're just getting this from the news wires, and I guess we have to place this in context, because we know that already the Ghana Medical Association has said its membership will lay down their tools, even ultimately likely to resign from payroll of the Ministry of Health if they don't meet certain basic conditions. But now we're even getting the junior doctors of the 2014 year group of the Korle BU of the Kwame Nkrumah University of Science and Technology, School of Medical Sciences, saying that they are laying down their tools unless their salaries are paid for the last 9 months. What do you make of the effects of some of these protestations or picketing or strike actions by the medical doctors on healthcare provision?
Exactly. I think the college have had a lot of experience with the Ghana Medical Association and government for this prolonged issue of not meeting the demand of these medical practitioners and group of interns, as well as they also responding sometimes with the wrong approach to government. We are quite mindful that we have inadequate medical personnel in the country, and so everything possible, especially with the coming of the new health minister, I know his proactiveness. He should be able to put a stop to all this prolonged difficulties in communicating clear to this and meeting the demands of the medical association. I also think that it is high time government develop a very comprehensive strategic plan on how we want to train our medical personnel. If you get to Cuba, they have a very well-informed structure. Likewise in Nigeria, if you are a medical doctor and you go on strike, before you return, someone have taken your position. And so they are made in such a way that they have trained a lot of medical doctors so that you don't have the opportunity to use that opportunity to create unnecessary tension. But government have to be proactive in dealing with the concerns of the Ghana Medical Association. Most of the time they are very legitimate, but the approach in which government tackles is not very appealing. For example, we know that these people who are in housemanship, even if you pass all of them out, they will still not be adequate to meet the health demand of Ghanaians. But we don't want to absorb more. So we should have a clear policy on how many we want to train within the next 5 years, within the next 10 years, within the next 20 years. We should have a clear policy on that. The other aspect is that we should be able to create opportunity for those who are already in the field to have specialist training within or outside the country. Sometimes you see a medical doctor who is a general practitioner and he can be there for so many years without going through, because he has to look for funding to be able to specialize in certain area. And I think government has not been very clear on that. If it is clear, people are not aware, the fraternity is not aware, and sometimes they have to struggle on their own to save money to be able to upgrade their skills and competence. And that is also something that is good for our country. We still have deficient in medical doctor in most of the district. So sometimes some of the districts you find only one, or sometimes you don't even have one when the other one is leaving. And so government need to be very, very proactive on that. But I'm calling on those who want to go on strike to still be a bit patient, because if they go, it is not government alone that suffers. We have so much people who suffer from that. But they should still use the internal mechanism. I know we have a procedure in preparing yourself for strike. They should utilize all the mechanism. But I'm happy that we have a new health minister, which is ready to do the job. So if he has heard about it, he should be able to use the available facility and the team that he is having around to be able to meet this group of people, to dialogue, to agree on a roadmap, and they should all be committed on the roadmap to be able to
Let me ask you
communicate
this.
well.
Supposing government calls the bluff of the medical practitioners and say, if you like, to hell with you, go resign, what will happen to the health sector?
Yeah, that's a chaotic situation.
Or we have nurses, they can take care of the business of whatever.
Yeah, but that's a chaotic situation. And I don't think the medical practitioner will do that. They will not go that much. They have, if you have witnessed their graduation, they swear they are practitioners. And what they say there is a very important commitment that they make there. So whether government is responding to them adequately or not, they also still have the responsibility to do what they have promised themselves to do. And so it's a very dicey situation. But these doctors also have wives, they have children, they have families. I know my brother was educated by our parents who did not have access to education. Now they are very old, and so they are looking forward to see that he takes care of the family. And so these responsibilities are also pressures on these medical doctors. They are also responsible for the families. And so it's a very important kind of thing that we should look at it. But in all, government is the lead responsibility person to be able to ensure that they are able to use the internal mechanism to communicate effectively with the Ghana Medical Association.
Okay. Now, as we go forward with this, how do you make sure that as a coalition you also tend to dialogue with the Ghana Medical Association for them all to perhaps hold the fort a little and make sure they continue their negotiations with government on the subject?
Yeah, we are in a very healthy relationship. I just said recently we had a program together at the British Council. We were given the opportunity to make a lot of input. So we have a very healthy even with the telephone we are able to pick up a conversation. And so as it is now, there's a goodwill and we will make an input. But what we expect to see is we want to see a healthy dialogue between government and the medical association. That is the most important thing. We will be watching to see what happens. Where we need to make input, we will make input. But we hope that the new minister and the team should have a mechanism which they already have, but I mean it has to do with proactiveness.
It has to be deepened as far as the consultative process is concerned.
That if the Ghana Medical Association sees the approach, which is appreciative, I think they will take an alternate decision.
Or they may soften their stance.
Exactly. But if they don't see, and government don't have to be seen as entrenched
or insensitive.
Yes, they have to show a welcoming face so that the dialogue can be more effective. And once there's trust in the dialogue, they will be able to resolve amicably the issue.
We have to end our discussion. So, but before we go, we know that the subject of the increment of the fees at Korle BU could also be replicated in the other teaching hospitals, if that is possible. How are you going to make sure you preempt that?
First of all, I want to draw the attention. Government Assurance Committee has the responsibility to ensure that some of these things are not overcharged. So, and I know that if they are listening, or if somebody within the ministry is listening, they should be able to cross-check to find out and whether there are even due diligence and put in place before this announcement. If there are due diligence, they should still consider it, because they are trying to drive away a lot of people from the facility, and we are against that. We think that they should not create any unnecessary tension, and they should not deter people from accessing healthcare services at the facility. And we are also encouraging our members to watch out to see where some of these things happen, so that we can take it up and pursue it amicably. Okay.
Well, thank you very much, and thanks also for passing through our studio. We're very grateful, and that's Gabriel. Gabriel Benaku is the chairman for the Ghana Coalition of NGOs in Health, and helping us do the discussions on the increment of charges or fees that have been currently levied on services by the management of the Korle BU Teaching Hospital to the detriment of patients. And as we found out on Monday, my colleague Hannah Odame had gone there and saw that many of the patients were not too happy with the current charges or increments. And well, we're hoping that the coalition of NGOs will have a deeper dialogue sessions with the management of Korle BU and the other teaching hospitals, really, to make sure that patients are given the needed quality of health services, but also the charges are adequately looked into as far as compared to the affordability of the patient. Thanks for joining me, Mr. Benaku.
Thank you.
All right, so we're taking a break. When we come back, well, we'll be looking at a more subject. But do you remember the Independent People's Party? They call them the IPP. And the political party led by Kofi Akpaloo is going for Congress. And the flag bearer is joining me in the studio this morning. We'll be talking widely about what their objectives are now. Do they still think they are still relevant in the scheme of things as far as Ghana's political dispensation is concerned? And so do stay on. We'll be right back.